All right, guys, a quick review on discussion board. I think this was 5. So with our young lady who was 2 months status post ankle injury. So this was actually one of my patients. And one thing I consider you to think about, like, yes, we do have to start her at the ABCs, those rudimentary exercises, but then we need to progress her pretty quickly. So yes, it's absolutely appropriate to start with ABCs, ankle four-way, heel raises, all that stuff. But it needs to escalate, like I said, quickly, because she's not in the inflammatory stage anymore, even though her symptoms present like that, because she's 2 months out. So this is more of a chronic thing at this point. So it's nothing acute. So again, you're not wrong in choosing those, but then we may need to make sure that we're progressing really quickly. I think I saw her for a total of 5 visits. After 2 visits, I mean, we were jumping, jogging, all that kind of stuff, because she just needed to get out of the dang air cast and get some stability. But yeah, she was a quick rehab. One thing, don't forget unstable surfaces. Like in your progressions, they should have seen a lot more BAPS boards. They should have seen, some wobble boards. I saw it a couple times. They should have seen some Dynadisc and, the Bosu ball. All those things need to be used on an ankle sprain patient. One thing to consider too. So like when you guys were demonstrating lunges. So yes, generally when we think of lunges, we're not going to have the knee go over the toe. However, when we're trying to get ankle range, it's not necessarily a bad thing to have them go ahead and lunge forward a bit more to get us a little bit more of that dorsiflexion range of motion. Again, like when we're doing it for strength and things like that, yeah, that's not our intent. We need it to be performed quote unquote correctly. But when we're doing the lunge and our range might be a limiting factor, we might let them modify it a little bit so that way that they can get more of that ankle range of motion there too. In some of your balance exercises as well, you can have them do for ankle range. So like you can use the wobble board for ankle range of motion, not necessarily for balance all the time, but like have them hold on to, you guys don't have parallel bars, but have them hold on to like the table or something and rock it back and forth holding on to get that better range. But yeah, so the biggest takeaway on this, don't get too hung up on that, she's presenting so acutely because she's 2 months out. So, we're not in the acute phase anymore. While yes, we do have to address the deficits and the pain, we have to also understand too, when it comes to that healing process, that we are well on our way and making sure that we're stressing those tissues really soon. Now, mind you, if she came back in and obviously her pain was up and she had swelling, she didn't have any minimal swelling, then we reassess. But as long as she is doing well, it's game on, away you go. Sorry, that's probably loud. The last 3 weeks, like I said earlier, you are going to have a certain person on your progressions, a certain athlete injury, and you're going to stick with that for the next 3 weeks. And just take note of what you are to do, because it's a little bit different. Like I had mentioned when I was over there, you are not finding an article, but a protocol for said injury. So just making sure that you're taking note of the timelines and everything. Thanks, guys.